Welcome to the Ultimate Dental Podcast, the place where you can learn how to create a dental practice and a business life that you love. Listen in with Dr. David Moffet as he interviews successful entrepreneurs and successful business people and successful dentists as they share their business successes, their stories, and their breakthrough ideas, sharing pearls of wisdom that you can take back to your practice and implement immediately so that you can have that great practice with more patients, higher profits, and less stress. This is the podcast where great dental practices meet with successful business processes. Thanks for tuning in to the Ultimate Dental Podcast, the podcast where thought leaders, industry experts, and thriving practice owners reveal their very best tips, tools, and strategies that will help you grow your dental practice faster. Now, here's your host, Dr. David Moffet.
Hi, everybody, and welcome to today's episode of the Ultimate Dental Podcast. I'm your host, Dr. David Moffet. I'm in Burrawang in New South Wales in Australia, and it is just coming up to 10 o'clock in the morning on Wednesday morning, and I'm talking to Dr. Erin Elliott in Post Falls, Idaho in the United States, where it must be coming up to about 5 o'clock in the afternoon. Day before. Yeah. That's one concept that Americans have trouble with, that they're not leading the world in the time. They're always behind. And the Hawaiians, I guess, must really suffer. But other than that, Australia's got to be first at something, kind of. New Zealand's a little bit ahead of us. But Erin, great to meet you virtually. We've never met, and in fact, we've never spoken before, but we are social media friends for a long time. And as you know, and as I know in dentistry, the cream rises to the top. So people of the same mindset and the same thinking tend to associate. They're always at the same courses. They're always at the same continuing education. And it's great to chat with you because you've got a really interesting story in dentistry, I think. So, from what you've told me via email, you started off living in Southern California, then went to college in Buffalo, New York, and then university in Nebraska, and then settled in Post Falls, Idaho. Tell us about that story.
Well, like I was telling you, when you grow up in California, you literally feel like the world revolves around you. And I did realize there's a whole world out there that I wanted to experience. I'm very adventurous and love travel. And so going from Southern California, I visited UCLA one weekend and went to this little small private school in the middle of nowhere in snow country. I decided that's where I wanted to go. Also played soccer. Do you call it soccer? I know you have Aussie rules.
We have
'Cause I
soccer,
have
we
been
have
to Australia.
rugby league, rugby
I just didn't know if
union.
you called it football. So I played soccer there at undergrad, and when it came time to find a dental school, I'm like, let's just throw our hat in the ring. And I got in at Creighton right away. I didn't even have an interview. So I was like, okay, let's move to the middle of the country. And we beelined it here for Idaho because it was lakes and mountains and trees without humidity and bugs. But I will say I did get to visit Australia, and it did remind me a lot of Southern California when I was there.
Well,
Like
I
eucalyptus trees and
tell people that the climate of Sydney is like San Diego,
Mhm.
but with far less people and far less cars, though it's catching up all the time.
Yeah.
As I mentioned to you, I moved out of Sydney. I wasn't born in Australia. That's another story. But I was made in Australia, but I wasn't born in Australia, if that makes sense. My
Yep.
father was in the Air Force. And so I came back to Australia at the age of 2 and settled with my family in Sydney and lived in and then worked in Sydney all my life until I retired from being a dentist. And I'd already started coaching dental practices, and, Zoom and remote coaching really appealed to me. And I thought, why have two houses? I had a house in the country and a house in the city. So we just moved to the countries. As I was saying to you, the elevation where I live in Australia is about the same as where you are. That quite surprised me because I thought you might have been higher up there, being in that mountain time zone, but I'm open to education.
And
Um,
and snow, that was the big difference, is we get snow
yeah,
and you don't.
yeah, we don't. The other thing about like the next village on from ours, I don't know if when you came to Australia, you were made aware that Australia is a land of big things. So we have
Yes.
the big pineapple, the big prawn,
Big snake, the
the
big
big
bugs.
yeah, but we have statues like the big banana in Coffs Harbour. But in our next village, guess what we got? We got the big potato. So
Oh,
Idaho's the home of potatoes, but
yeah. We
the big
supply all the
potato,
McDonald's French fries.
yeah, you do.
Idaho.
Well, the other thing about where I live is that, and you would know this, did you ever see the movie Babe, Pig in the City? So that was filmed where I live. And so
Oh,
they painted the big potato pink like Babe the Pig. And people like it so much better than the brown color it was before that I think it's going to stay as the big memorial to Babe. But anyway, there's not many people live where I live. The population of Australia is the same population as Texas. And so the village I live in, only 250 people. So that's real small town compared to USA. But settling in Post Falls, you were telling me about the growth since you've been there.
yeah. Our little county here, we're way up in the panhandle. So Idaho, it looks like you're pointing a finger. So we live way up in the top. So I am from Idaho, but just the tip is what we say. And it was kind of smaller. We're just across the border from Washington State, which has a bigger city there. And we loved our small little community, but it really has exploded. A lot of Californians, Seattle people moving here, especially during COVID. Like, we were really open in the state because it was kind of state by state, the COVID regulations. Like, I was off for 5 weeks here at the office and then back at work. And our restaurants were open after 6 weeks and gyms and all of that. So a lot of people flocked here during that time to kind of live a little bit more free. So we've seen a lot of growth, but it's been good because along with the people have come teeth, and along with the people have come airways. So our practice really, I am a general dentist. I do a lot of regular dentistry, but have a special focus and interest in implants, and I do like some impacted wisdom teeth. But I think one of the big things I'm known for in the community is sleep apnea. And I know Australia has a huge awareness of sleep apnea. I actually did a webinar for a company in Australia, and we not just screen for it, but also help treat it with an oral appliance. And since the CPAP was discovered and started in Australia. Somnomed is one of the biggest oral appliance companies, and they are started in Australia. So I know you have some awareness and presence. But even in small towns, that's what I discovered, is that even people in small towns have sleep apnea. So we've been able to not just help a lot of people with their dentistry, and we have a technology focus with CEREC and cone beam and all those things, but also help people with their sleep.
So you've jumped into the subject before I got to ask, but I
Right.
was going to ask, how did you get an interest in sleep in a small town community? What made you?
So I've been at this 22 years, dentistry. And it was about 16 years ago that I saw at a conference, there was a sleep physician there. And I was like, what is he doing here? And so I went in and I was just floored and fascinated. And one thing that you know about me from social media that we were talking about is how much I love to sleep. I can sleep anywhere. It really was a good sleeper. I was born an old lady. Like, I go to bed early, I get up early, I have great sleep hygiene. I was like, oh, I love sleep. And I discovered how many people were thinking they were getting good sleep, but their airway was closing down all night. Or how my mom had insomnia because of my dad's snoring. And I realized just how many people it was affecting, including my own family, that I was like, how they were literally zombies. Like, their oxygen was down in the 80s. Their airway closed down like 200 times throughout the night with zero awareness. So it's one of those things that once you see it, you can't unsee it. The problem is it's sometimes hard to get going. We have the first hurdle in the States is medical insurance, but you have your dental program that actually helps pay for it. But as soon as I was like, okay, I'm going to not let this go. It was like a dog on a bone. And so a lot of dentists start, but kind of give up because it's not dentistry. It's not like adding implants. It's not that easy. And so I am one of the few in the area that has really taken it on and have a system and a workflow that gets people the help they need. And it's been awesome. And turns out I may or may not snore. Of course, like all my patients, I actually stopped asking, do you snore? And I ask instead, has anyone ever told you you snore? Because that's a different question. And my husband's like, you were snoring last night. I'm like, oh, it was just allergies. I don't have allergies. And I was like, no, I can't snore. And so there's video that was posted at one point of me snoring. So I couldn't argue it anymore. So I'm a appliance wearer myself because it's not an old fat man's disease. It hits young, fit females. If the story and the symptoms are there, get further help. Don't just try to mask it with sleeping pills or melatonin. I don't love melatonin.
It's one of those things, and I I remember when I was practicing dentistry, and a friend said, "This is back 2006." He said, "David, the future of dentistry is sleep
Mm-hmm.
dentistry," and I'm going, "What? Yeah, what?" But I studied. We had somebody from San Diego come down to Australia every year, and he'd come for 3 weekends a month apart, and I remember going to that on my friend's suggestion, and I thought the first day it was just anatomy like so intense. And I thought if I had my golf clubs here, I'd be out playing golf. This is not for me. But I stuck at it and I went every year because every year there was further education in it. So I understand it. But I think the biggest thing that the public don't understand is that if they have a sleep disorder that starves them of oxygen while they're sleeping, this is something that's going to shorten their lives. And so what are they going to miss out on? They're going to miss out on walking their children down the aisle. They're going to miss out on playing with their grandchildren, dying in their 50s instead of dying in their 70s. That's the
You'd think that'd be motivating, but it's really not. As soon as I can find out what it is that motivates them, then they break down those barriers. After all this time, I still haven't figured out the psychology of men. One of my favorite questions, and my friends tease me that I'm part dude, like I am a tomboy and all of that, but I'm like, if you could feel better, why wouldn't you want to? That's the part I don't get is the denial. So one of my favorite questions that I ask dental patients as well is, what is it about the blank that concerns you? So we have a lot of patients recently that are anti-X-rays. And it's like, well, what is it about X-rays that concerns you? Well, I heard they're bad. Or I had a skin cancer on my nose, so I don't want any more radiation. Like it kind of gets to the bottom of what really the problem is. If it's money, they'll say, they'll eventually tell you that. So I'm like, what is it about doing a sleep study at home to see if you may have this disease that concerns you? They're like, well, I just don't really want to know because I'm not using that mask. And I'm like, well, you don't maybe need a CPAP. We have this oral appliance, like I told you. If it's the top and bottom teeth and it postures the jaw forward to keep your tongue from falling back and keeps your airway open so that you can stop snoring and you can actually sleep deeper and wake up refreshed. And they're kind of like, well, like I'm like, okay, I can tell you're not concerned right now. When you are concerned, if anything changes, we're here for you. So I've kind of given up on the strong arm tactics, but there are some times where they're kind of, younger hotshot guys. And I'm like, okay, bro, I'll have a bet. Prove to me you don't have a problem and I'll leave you alone. And women are usually present as insomnia. So because progesterone and estrogen help keep our airway open. So the symptoms of sleep apnea and sleep disordered breathing in women is a little different. Usually the men sleep right through the night. They sleep fine. They snore and they may not wake up refreshed, but that's normal for them. That's just getting older. That's just how it is. That's how I've always been. But women present a little differently because as their airway starts to close, their brain says, no, we can't let that happen. Airway starts to close. No, we can't let that happen. So they're in this constant battle of fighting to keep their airway open, which stimulates the sympathetic fight or flight, which releases cortisol, which increases inflammation, which makes it harder to lose weight. Increased weight can have an effect on the airway. but they usually present as light sleepers, toss and turn, wake up at 1 a.m. and 3 a.m., clenchers, and usually are exhausted, not like they're going to doze and fall asleep, but just deplete of energy. And the first thing that physicians do is look at thyroid or hormones or, oh, you can't sleep, here's a sleeping pill, when really getting a sleep study would be so important. But even beyond a sleep study, the medical world only looks at one thing on that sleep study. It's called AHI. They're looking for apneas and hypopneas, which means your airway closes down so much that your oxygen desaturates 3 or 4%. So that's kind of a tall order. So if your airway closes down for 20 seconds, you would, if I had you hold your breath right now for 20 seconds, your heart would start to race. You'd kind of feel a little panicky. And if your oxygen only went down 2%, they're like, oh, it's not bad enough yet. And so I think it's important, even if you had a sleep study and you're like, and your doctor's like, you're fine. Well, you really could have sleep disordered breathing. You could have an airway issue, but because it's not bad enough yet, they ignore it. And so I really like looking deeper and really telling the patient's story of what's going on with them. I can show them, look, your airway closed off and you switched sides. Your airway closed off, you woke up. Your sleep was interrupted. You only got 10% deep sleep. You should be getting 20. You had no REM sleep. Like all of this self-discovery is pretty amazing. And so this awareness turns to like ownership and creates some urgency of like, oh my God, this is what's always been wrong with me. And you're the only person that's ever explained it.
So your conversion rate should be up around the 80 to 100% based on that.
It's pretty high, but I also would say if they're coming in for a consult, they're kind of they kind of know what they're coming in for. The trick is, the hardest place to start is the patients in your dental chair. But because they're like here to get their teeth cleaned and you're going to talk to me about what? But my team is so engaged because each of them has been tested and most of them have appliances or their bed partners. So they're so well-versed and they're well-versed on what to look for. And clenching and grinding is one of the big ones, as well as a scalloped tongue.
Oh, yeah.
The
Have you got one?
scalloped tongue, yeah. Scalloped tongue shows that there's not enough room for the tongue. So at night, your tongue presses up against your teeth and takes on the indentations of the teeth. So I look before the patient sticks their tongue out because then it stretches. So a scalloped tongue is 70% predictive of an AHI over 5. And then clenching and grinding, people are still arguing over it. Same with, how there used to be the abfraction debate. To me, it's so dumb. It's enough for me to raise a question. If you're clenching and grinding, that is your brain's way of opening the airway, bracing open the airway so that you can breathe. Before we make you a night guard for muscle pain for clenchers, most grinders don't know they do it. Even when you fit their teeth together perfectly like a puzzle, they're like, I don't think I do that because there's no pain. But before we make them any sort of night guard, I will do a sleep test at home. And the nice thing is in Australia, you're allowed to own home sleep test units as a dentist and send them home with patients. And so that is like the ultimate screener. I prefer something called a watch pat because it shows those sympathetic responses, those arousals, they're called. So it shows if their sleep's interrupted and it just wasn't bad enough to be considered an apneic event. It shows the apneas and it shows any centrals if needed. So the test really, especially the watch pat and the reports it shows, it gives a ton of information. So that's where the conversion really happens, is making it easy to get to the sleep study.
So you attract people to your practice based on marketing to sleep disorders or poor sleep, as well as trying to identify those in your general practice who have it but don't know they have it or don't want to know they have it. How do you separate that? Because that's one of the problems that sleep dentists encounter, is that they're still doing general dentistry, and so the new patient with a sleep disorder rings up or looks on your website and goes, "Where's the sleep?" Oh, it's like the 20th thing they do. Do you market yourself? Do you have two separate websites?
I do. I kind of have it's not a different separate business. We still bill like medical insurance credentialing is through Post Falls Family Dental, but I have what's called Sleep Better Northwest, and it's more of like a marketing thing. So if I'm going to spend money on marketing, like in the newspaper still works around here because people want to see what new businesses are going in, who's getting divorced or arrested or dying.
Hang on just 1 minute. Just for the younger people who are watching this, a newspaper is something that we used to have like 30 or 40 years ago, where people got yesterday's news today in the morning and thought it was current. Now we have the internet. Back to you, Erin.
Yeah. Yeah, so newspaper still works online. I have some rap videos out there that are pretty fun. So there's a variety of marketing that I do, but it's easier to market sleep because that's what sets us apart. There's a lot of dentists that advertise, and it's like I think the technology makes us special. But I also think the sleep makes us special. So if I'm going to spend marketing dollars, it's usually for sleep. And then when they come in, they're like, wow, this is pretty awesome here. So I work 3 days a week and I do 2 columns of dentistry. If I'm doing surgeries, I try to block everything around me out so that I don't have to leave. But I have a team member. My team is all educated on sleep, but I have one assistant that pretty much does that full time. And so, yeah, I'm a part of the consults, but I don't, as long as I'm in the building, I don't have to deliver the appliances. If your assistants are allowed to deliver a night guard, you can deliver a sleep appliance. I don't know what the regulations are there, but here it's very team driven. And so I am there to help make decisions, help if there's any side effects, but for the most part, I don't have to be in charge.
Yeah, it's the regulations for dental assistants are actually tighter now for what they can't do than what they used to do when I graduated.
Yep.
It's ridiculous what they're not allowed to do now. They're not allowed to assemble an anesthetic syringe. They're not allowed to dismantle a used anesthetic syringe. And so it's like, what are they sitting there for? They're not doing anything. But that's in Australia. But the good news is that this audience that I have for my podcast is global. So anyone from the real world don't need to worry about what goes on in Australia, because Australia is technically very, very
Yeah.
backward
We
in
don't have a
some
lot
ways.
of laws in Idaho, so I'd say most of the states, you can hand over the intricacies and day to day to an assistant, and you're there just like as part of the consult.
But the interesting thing about what you said there, and you raised a lot of interesting concerns, and a lot of dentists miss those key triggers in conversations with patients. But one of the things that I remember a dentist friend of mine from Kansas was telling me, and he said that about the patients is that the general population where he is, and that's Midwest, he said their attitude to their own health is, well, it's not my job to fix it. I've paid my taxes. It's the government's job to keep me alive when something goes wrong, as opposed to preventing things or becoming aware of these things. And so, I tend to think that dentists need to be more aggressive with their marketing to their patients and tell them exactly what the worst thing is. And it goes to in diagnosis. Oh, it's just a small hole. It's a little cavity. It's a tiny
Yeah,
crack. All the softening language instead of tiny. You and I have both seen teeth with no restorations that have cracked vertically and needed extraction. It's just,
right.
where did that
Just
come from?
it's just a little bit of your oxygen in the set.
Yes, exactly.
Oh, I try to find their pain point though, like what are they moving away, meaning I don't want any pain, or are they moving towards like I want to be healthy? And so I feel like you can ask them like, are you preventative minded? Because these are the consequences if not treated. Or do you want to avoid pain, such as your wife being unhappy with you? Or there's a ton of health consequences, right? Hypertension, diabetes, increased risk of stroke, relationship discord due to snoring,
Mm.
crankier. I said diabetes, acid reflux, and nocturia or frequent urination at night is directly related to sleep apnea. They always think it's bad prostate or getting older, but if you go more than one time a night to pee, it's probably sleep apnea. If you have dreamed that you've drowned, I could 100% guarantee you have sleep apnea. But lastly, is erectile dysfunction. And that's not something my patients talk to me about, but I can see consult notes and stuff from their family physician. It's a very common problem. It's why it's every other commercial when I'm watching the NFL. And it's reversible if you have oxygen. So there are times that I might pull that out to motivate people too. So it really is interesting to try to, it's not, for me, it's not selling. I'm not a hard salesperson. I'm like, hey, we're here for you when you need us. If you start noticing some of these symptoms, I wouldn't just, dismiss them. There is a sign of something going on. And my
Yeah.
favorite is when patients say, oh, no, 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 I had a sleep study. It said I was fine. My first question is, oh, when was it? And when they say 10, like 5 years ago, that means 10. And I'm a smart aleck. And I'm like, oh, you know what? It's kind of like when I went to the optometrist when I was 16. I had 20/20 vision. So I haven't had to go back. I'm fine. I was like, things change.
I love that. That's exactly, you've got to be in there.
Yeah, I usually say too, I'm like, well, things do change as we get older. So I would definitely let's screen you again to see if something more is going on.
I had a patient present for a cosmetic case, and his vertical dimension of his centrals was 1 millimeter above his incisal papilla. He said every time he went to a new dentist, they would call all the team in and they'd laugh. Look at this guy. Look how bad he's worn his teeth. So we opened him up with an appliance just to get his vertical dimension right. And he said, I am sleeping better. He said, I just
Yeah.
thought I was waking up cranky and tired because I was old. This device has done that because, otherwise he'd smash the porcelain. So that's one story. The other one I had was a patient in his early 30s who had really big masseter muscles and wear facets on her lateral and canine. And I said, how do you sleep? She goes, I hate sleep. She said, I am in tears before I go to bed because I'm going to wake up with the worst migraines. So we gave her some oral appliances, and she loved us. But the thing that she said was her friends were saying, have you had cosmetic surgery? Because the masseters just melted off her face. They weren't needed anymore to grind at night and clench at night. And so she went from this face that looked like a pentagon to more a triangle, and she looked fantastic, even better. And she was, at 32, but to have that pain that they just think, oh, bad luck, the fairy with the bad sleep has tapped me on the head with a wand, and I've got to live with it. And I think that's what we've got to be passionate
Look
about.
how much your eyes have lit up. If you're listening to this, you got to see how excited he got. You get it. Once
Yeah,
that goes off, like it's so exciting. And you are going to get the cranky person every once in a while, the person that doesn't want your help. And that's why I'm like, there are so many more people that do want help that I'm like, cool, dude, when you're ready, I'm here. Moving on. And I don't know if you know the starfish story, but there's just a lot of people out there that could use our help. For every person you help, that's one less sleep apneic that's suffering.
now you're a speaker. You know that in Australia, the starfish story, if you mention that, that's the end of your speaking career.
Oh, really? That's funny.
It's so cliched. Made a
Yeah,
difference to that.
yeah. That I will never mention it again. However, I do think about it often because there are people that tell you no or in complete denial. And there's people that ultimately maybe need to go to CPAP or, like just because it wasn't good enough for their particular, sleep apnea doesn't mean you're a failure. It doesn't mean oral appliances don't work. Every human has their secret combination. And unfortunately, the medical world works in silos, right? You are going to get a CPAP or an appliance or Inspire or this or weight loss. It's like each person, you can use CPAP and oral appliance in conjunction. You can
Mm.
use appliance and Inspire in conjunction. Some people may need expansion, not everybody, because dentists here in the States are like, expansion or Invisalign's going to cure your sleep apnea. Sleep apnea is multifactorial.
Yes.
Weight's just one part of it. Losing weight doesn't necessarily cure sleep apnea. It's going to reduce severity. But we still have an anatomical issue, such as tongue or tonsils or crowded airway, vaulted palates, and not enough room for the tongue. But also physiologic. Your airway could be strong and sturdy and not collapse, or it's flat and mushy and it collapses all night. So it's physiologic too. It's not just anatomic. That's why I get really frustrated when it's like forget oral appliances. You may change a bite. You need to expand and, open up this suture from the maxilla, that's not going to necessarily cure them. So there's just a lot of tools that we can use, including myofunctional therapy and tongue tie releases, weight loss positional therapy. There's times that I'm going to discuss some of the supplements that people reach for, these biohacks. But unfortunately, people think that, I'm not sleeping well. Let me reach for something that's natural, like melatonin. But melatonin actually is yours. I don't think it's over the counter for you, but
I think we can buy it somewhere. Yeah, I think we can.
melatonin, it's a hormone, so you
Yeah.
can't easily replicate it in a pill or a tincture. But what we should be doing instead is stimulating our natural melatonin. Plus, melatonin is a sleep initiator. It doesn't keep us asleep. So yeah, there's some things we can do a sleep routine to make our sleep environment calm and peaceful and not stressful, like the girl that you talked about. But melatonin, even though it's natural, is not a great sleep aid. So I tease, I'm like, well, do you know the most natural drug that you could use for sleep? And people are like, oh, what? I'm like, oxygen. So that's what an oral appliance can do for you, is split open your airway so you can get oxygen, and then your body can finally rest. And they're like, oh, I want that.
There's something that I just recently heard too, and that is that sleep apnea is more prevalent in males than females, but females catch up as they age, as they
Menopausal age.
menopausal. Yeah, that's the word I was looking for, and then they catch up, and so it's a whole new dimension there. Not only do they say they're not sleeping because their husband's snoring, but now all of a sudden they're not sleeping because of their own physiology as well. Are you finding that?
Yeah, oh yeah, that's what the studies show. It's like 1 in 4 men, 1 in 10 women, but I do think it's higher than that. And then 50% of the population over the age of 50, with women catching up to men in menopausal age. That's because the progesterone and estrogen are protective of the airway. They improve respiration. But in menopause, what happens to those hormones? And so all of a sudden, you're getting these insomnia symptoms that you might not have had before. So you mention it to your doctor and they go, oh, welcome to the club. Well, that's just menopause, when really it's their airway collapsing that might not have used to. And so, like I said, women usually present as insomnia. And the reason why I said is, as soon as I say, light sleep, toss and turn, they're like, nodding their head, engaged. And I say 1 a.m. and 3 a.m., wake up at 1 a.m. and their eyes get wide like, is she watching me? How does she know this? And I've had women break into tears after I went through that, because she's like, I'm not alone. I'm not crazy. I'm like, we see this all the time. But the reason why 1 a.m. and 3 a.m. stands out is because, remember, we said clenching and grinding can help brace open the airway. So that's like a default for some people, is to clench. Well, in REM sleep, our airway is actually at its weakest point. It's at its worst. And you can see an increase in sleep apnea, specifically in REM. Well, also what happens in REM sleep is our bodies are paralyzed. It's so we don't act out our dreams. So all of a sudden, we're breathing efficiently, our intercostal muscles are working to them paralyzed. Our airway's at its most compromised, but we also can't clench our teeth or turn over. And so our airway is collapsing because we don't have any protective mechanisms anymore. And so their body's like, I'm just going to wake up instead. And REM is at its height at 1 a.m. and 3 a.m.
So complicated. So
But
you
that's
just
why,
complicate.
that's why it resonates with people, like, oh my gosh, she knows my struggle, or she's seen this before. I'm not alone. And those are the people that need help. But if they didn't talk to a dentist or have a dentist go and preach it to all the physicians around town, how else would they have known? So that's why it's exciting what we do. It's not just snoring. I had my tagline when I first started for Sleep Better Northwest was, stop snoring, start living. I was like, that was brilliant. But it took me a while. It took me like 4 years to discover in all of my, patients and consults. I'm like, it's not just snoring that we're dealing with.
Yeah.
And I started focusing more on the women in insomnia. And it turns out women and people with insomnia want help more than the guy who sleeps just fine. And he just gets nudged when he snores too loud. So we're here for both.
Yeah, it's a huge market, and it's still not being treated as seriously and as well as it should be. And financially, it's a huge burden for governments and economies. That's one of the things that I find really impressive about the United States is that there is money in the health budget to help people with sleep disorders because just the absenteeism, the driving, the car accidents, the early deaths are a
Yep.
huge burden in retraining employees as well during that time.
Yep.
And so,
Untreated sleep apnics use twice the healthcare dollars.
yeah,
It's pretty good return on investment for a $2,000 appliance.
very good. Yeah, yeah.
25, you'll get your money back for sure.
And once somebody's got an appliance, they're pretty well committed to the rest of their life, making sure that that appliance is working optimally or
Yeah.
needs replacing, whatever.
Yeah, and Somnum is a great quality one that I have some that are like 10 years old, and they come back in for their next appliance, and it's just like, they know the drill. Here's your money. Here's your appliance. See ya. And it's kind of like eyeglasses, though. It's not going to cure your eyesight wearing glasses. And so if you really want LASIK, then you would go get a maxillomandibular advancement. That's pretty much the surgery that works the best.
Well, yeah, that's a little bit more serious than LASIK.
Yeah, I know. But there's dentists that advocate oral appliances are terrible. They may change your bite. Go do surgery, full mouth rehab, MARPy, SARPy, expand it's like do everything but a low cost conservative starting point or end point for some people if they want to just continue with it and see how you could feel.
Mm, mm. It's a big subject, and I can tell from this interview you're passionate about it. Like you know your stuff, and you know the benefits, and you've got all the bases covered in terms of knowing the symptoms and knowing what we can do. The alternatives. There is an answer for everybody as long as they own the problem, I think, and that's the
Yep.
hardest part. Is I don't sleep that badly. I get by, and then that's the default to life threatening, life shortening, um,
Yep.
and that's not.
People are reaching for THC. My cousin's fiance, she's like, "Oh, I'm fine. I just eat an edible." I'm like, "Can we do a sleep test?" Turned out she had moderate to severe sleep apnea. It just wasn't affecting her because the THC makes it so you are sedated so you don't wake up. So she's still having airway issues. They're just not waking her up. And so as soon as we uncovered that, she was like the next day at a sleep physician because she doesn't live here. Yeah, that sleep study really is a big important step that, like you said, it really creates some ownership.
My sister's son, my nephew, my sister said, my dentist says that he's grinding his teeth and he wants to grind his teeth and equilibrate his bite. I said, and removing more enamel is not the answer. I said, bring him over. And I looked at it and I thought, well, this is an orthodontic correction, which was out of my scope. And so I sent him to my friend, and my friend sent him for a sleep study. He said, he's got sleep apnea and he's still at high school. So the treatment was dramatic in terms of how it changed his bite and opened his vertical dimension, made him even more handsome
Yeah.
and straightened his teeth, and no equilibration was needed. I
Well,
think
that's how it evolved in my office too. It's like, man, I see all these adults with vaulted palates and extracted premolars, and it's like, oh, if we could have just gotten to them when they were kids, mouth breathers, that's a huge sign. And so now we have a pediatric airway program too. And 4 and 5-year-old are like the sweet spot for us. And we can get involved early to get them sleeping at night, breathing through their nose, and getting expansion at the same time. We use something called Healthy Start, but it's a nighttime appliance. It's not custom, and it has all of these amazing tools to help expand the child, but also get them sleeping better. So there's a lot to it. And I just think it's exciting that it's becoming more awareness. The hard part is actually implementing. So that's why I hit the planes and the pavement and trying to help make it easier to get this implemented in your practice to help more people.
you've got a course. How often do you run that course, and does that make you travel to present it, or do you present it virtually?
No, I do have an online course. Yes.
Yes.
I'm I'm of the generation where I want to be interacting with people. I want live. And so I teach a 2-day implementation course. My home base is at the East Coast, Raleigh, North Carolina, or Nashville, Tennessee. Once in a while we go to West Coast, but I do about it 3 or 4 times a year. And I do have an online course, and then I'll go to like regional dental conventions and give like 2-hour talks, study clubs and stuff. But yeah, I just love to get the word out.
Yeah, well, it's important because, people put down, oh, you grind your teeth, you must be under stress. And I learned to throw that excuse out because I said, little kids grind their teeth and they don't have wives, mortgages, or bosses. What stress have they got? It's got to be
That's
physiological. It's like not
what I
getting
told my
oxygen.
kids. I'm like, dude, you got it made.
Yeah. So there's no stress. Yeah, I'm stressed. That's why I grind my teeth. Yeah. In fact,
Yeah.
you raised the abfraction question. I got a new hygienist last week, and she goes, "Oh, you're brushing your teeth too hard." I'm going, "I can't brush. It's a plastic toothbrush, and this is the second hardest substance in the in the world. Diamonds
That's
are
why
hardest."
that's why it's ledged out like that, and that's why the filling pops out all in one piece.
Yeah, that's exactly. I said, "These have been like this since I went to dental school," and they said, "Oh, one day you're gonna be able to flick your teeth off." I said, "It's because I clenched on them, I didn't even know my teeth were worn flat until I took my first impression in dental
Yeah,
school." So,
I
yeah.
thought everyone had a tori on the top of their palate.
Yeah, I asked my dentist about periodontal disease, because I found that as 28 years in the one practice that my patients who are my age, who are aging with me, all of a sudden were developing periodontal, black triangle disease in their 50s, and they've been coming every 6 months. My dentist said, he said, you have no chance of you getting periodontal disease. Look at that buttressing on your mandible. He said, there's enough bone there. Those teeth aren't going to be ground out. You're fine. But I guess that's a sleep issue that's still causing me to
It could be.
clean. Could be. I better get back onto that. Erin, I know you've got to run. Yes, I know you've got to run. You've got an engagement to go to. I appreciate your time. Thank you so much. What's the best way for our listeners and our viewers to get in touch with you?
I can give you my email address. I think I respond pretty quickly. So it's Erin Elliott, DDS at gmail.com. ErinElliott, DDS at gmail.com. So Erin Elliott, DDS at gmail.com, 2 L's, 2 T's, and 2 D's.
Gotcha. And that's the easiest way to get in touch with you?
Yep.
All right. Excellent. And is there a website if they want to kind of look at what you
Yeah.
offer beforehand?
ErinElliottDDS.com.
Easy as that. All right. Well, Erin,
That's my your website, but the course is on there. So
it's been great talking to you. Thank you so much for your time. It's been a pleasure, and appreciate you being a guest on the Ultimate Dental Podcast. Thank you.
I can tell my tomorrow is already going to be great since you're already there.
I'm already here. That's right. Thanks so much.
Thank you so much.
Thank you for tuning in to another inspiring episode of the Ultimate Dental Podcast. We appreciate each and every one of you for being a part of our dental community and joining us each week on this incredible journey. If you found value in today's episode and you don't want to miss out on future episodes packed with expert insights and actionable strategies, here's how you can stay connected with us. Firstly, hit that subscribe button. Whether you're listening on your favorite podcast platform or watching on our website, subscribing ensures you'll never miss an episode. Secondly, share the love. If you know a fellow dentist or colleague who could benefit from the wisdom and knowledge that we share here, please share our podcast with them. Also, please share the podcast on your socials by simply clicking on the social icons wherever you view or listen to this podcast. Together, we can all do our bit to elevate the dental profession. And finally, stay engaged with us. We love hearing from you. Your questions, comments, and feedback fuel our mission to provide the best content for your professional growth, your personal growth, and for your practice growth. Remember, your journey to creating a dental practice and a business life that you love is our mission, and we're excited to be your trusted guide along the way. Thank you for being a part of the Ultimate Dental Podcast. Until next time, keep smiling, keep striving, and keep on tuning in to the Ultimate Dental Podcast.